thank you all for joining. And as we see, it's almost as though this was a prediction of how coronavirus is impacting communities of color all over the country. You're seeing the impact of pre-existing conditions, which is probably related to two areas. Number one, inadequate health care for the most part in many of our cities, and then the issues that bring us into the hospitals in the first place that's tied to our diet and the food we're eating. I'm finding two extremely challenging places as we engage in the conversation here in Brooklyn. Brooklyn has the largest numbers of deaths for coronavirus, by the way. We lead the entire country, and the country leads the entire globe. So, you know, that's a title that we're not comfortable with having. But I'm finding, as I talk to many of my leaders in this space, that it's a difficulty in accepting the fact that partnered with our inadequate health care is the diets that we're having that is feeding the healthcare crisis, and that's the reason we're in the hospitals in the first place. And so I wanted to have a conversation with you, and so I want to open this discussion and hear some of your ideas, some of your thoughts, and some of the things that we can push not only here in Brooklyn, but across the entire country. And so I'll open the floor to you.
So I recently was a part of this committee where what we did was we put forth like this petition to Congress about expanding WIC and SNAP, so in that way people are able to get home deliveries. And because of the issue is that they're not able to get out of their home, and it's not accepted by some of these meal delivery systems. And so that's a means. And so we have to incentivize individuals that, listen, partake of these fresh fruits and these healing food components. And we have to show a better way. And whether or not it's through farmers markets, whether or not it's through community gardens, which are being done, whether or not it's through more of institutionalized, getting at the school levels, which are a lot of work is being done already in that vein, but really hitting the kids where they're eager and where they're hungry and they're open towards this change becomes important. Then next we hit for individuals who are on public assistance. And so we incentivize and make it preferential for them to purchase these fresh fruits and vegetables, which historically we know, things have changed a little bit, but historically that wasn't the case. Government cheese and the products that were less ideal were the ones that were only available to people of color who were on public assistance. And so those issues have to shift. There's studies that have been done that when you look at government subsidized foods, that those are the individuals who have the highest burden of obesity, have the highest burden of high blood pressure, highest burden as far as of heart disease, are those all the foods that are subsidized by the government. And we know the statistics as it relates to the location solely to fast food establishments. So we're never going to get rid of those businesses completely, especially in communities of color, but we have to somehow be able to give people a replacement. Let them know that there's a better option, and that's through education, that's through access to as well, and that's through affordability.
Right? We know that we are suffering from more heart disease. We know that we're suffering from more obesity, more diabetes, more stroke, more dementia than the average American, right? So when you look at African American communities, you realize that more African Americans are dying from heart disease than Anglos. You realize that 60 to 70% of African Americans over the age of 20 are either overweight or obese. So there's so many underlying risk factors, these comorbidity risk factors, right, that are exacerbating the problem. So what we're seeing is just an accelerated version of what we were going to see anyways. It's just there's a spotlight on it now. No one's been talking about it, but the reality is that over 50,000 people a month already died of heart disease. Over 50,000 people a month are already dying of cancer. So like when you look at how lifestyle plays such an important role, we need to take this as an opportunity to continue to educate people, to continue to say, okay, the data is here. The numbers don't lie, So in essence, it absolutely is attacking African Americans, right? And until we solve that problem, we're going to be facing the same exact conditions into the future.
While you're right, there are programs set in place that have us to where we're not supposed to survive if we know that heart disease, hypertension, COPD, all these different things are something that's really hurting us. Let's attack that from the inside and say, hey, this is how we help our community out. We go out, we like, and I know it's tough because I think everybody in here understands that you talk about health and food to people of color, sometimes it's like you almost insulted them.
Mm-hmm.
You know, I think we've all been through that situation where you try to tell them, hey, bro, I'm letting you know, man, that barbecue chicken with the extra fat back, that's not good for you. Oh, man, my ancestors ate this. And it's like, all right, cool, but that's not where we are right now. We're not our ancestors. There's supposed to be evolution no matter what. And I think sometimes we forget that as humans, we always are supposed to evolve.
You're right. It's not just food. It's also, you know, our mental outlook, right? It's that mindfulness. It's not just that, it's our ability to move and to be, to exercise and to be empathetic and to love. Those aspects are equally important and play a role with stress and play a role in terms of disease outcomes, because perceived stress is a killer. We know that. We know you're more inclined to have heart disease and breast cancer if you're African American and you just perceive the stress and perceive racism that's there.
And as we talk about the COVID conversation, I am not finding the conversation dealing with how do we prevent from going there in the first place. We're talking about, listen, I want to make sure that everyone that needs insulin gets insulin. Everyone that needs statin gets statin. But the conversation needs to be, how do I prevent someone from prematurely having to get dialysis? How do I prevent someone from prematurely going on diabetes? You know, and so that is the place where we're not in. And I think part of the reason we're not in that place is because too many people who we look at for professional advice don't believe that that place exists. We can't ignore the reason we have the disease. And the reason, for the most part, we're having chronic diseases is connected to our food. You know, the numbers speaks for themselves that we are, in addition to the normal stress of being a person of color, we are eating ourselves to death based on the food that we have. And lastly, I want to wrap on this. We have to dispel myths that eating healthy is expensive. My food budget has decreased since I went plant-based. We need to teach people how to eat in their normal supermarkets. A bag of lentils, I make a lentil burger, I make lentil stew, I can make lentil salad. So we really need to dispel the rumor that eating healthy is too expensive to eat healthy, while we fight to deal with food apartheid, food swamp, food desert, whatever terminology people want to use. But while we're having that fight, showing people how to cook beets. We gave out food at a food pantry and we handed beets to people and they said, I don't even know what to do with that. So there's part of the education we must do to show people how to shop affordable, how to cook healthy, and how to live a healthy lifestyle. And I think it's doable because we're doing it every day in the borough of Brooklyn.
We eat that like we eat because we have all these food deserts around us. We hear about all the good foods that you should be eating. Eat this way, cook this way. Yeah, but do I have it available, readily available to me in my neighborhood? No, not necessarily. I have to go out of where I live to make sure that I get the best. Because in my immediate neighborhood, it's not there. But how many of us in these areas have that access without having to get on a bus or catch Uber, spend the extra money, something to bring home the food that we bought at a Whole Foods that does not exist primarily in these areas, congested areas. It's getting better, but slowly. Farmers markets are great, but we have to look at all of these other aspects there.
I want to do some housekeeping and point out some of the things that, you know, Lorraine is raising some good issues, but let's be clear. She has been so forward thinking that it is amazing. That resolution that she put together with the NAACP is an amazing resolution, and it's really a game changer on this conversation. And I think others should look at it and talk about how do we push this conversation forward, what the NAACP is doing around re-examining the conversation around health.
Yeah, I think that we can all agree that, Big Pharma is the greatest subscription hustle the planet has ever seen, right? From cradle to grave, they got you. We could help the hospitals more, but if you're already at the hospital, chances are there's things that you could have done to prevent yourself from getting there in the first place. And that is where I think the bulk of the work needs to be done. So there's so many things that we could be giving people in terms of tools and resources to be able to move in the direction of better health without affecting their pocketbook. That would improve their health vastly and very, very quickly. The African American community was the quickest in moving towards a plant-based diet. I don't know if any of you knew that, but the quickest moving community across the country is the African American community towards a plant-based diet. So the movement has already started. You don't need to have a lot of money. You don't need to spend a lot of time. It doesn't have to be overly complicated to change your life, to take the power back, to go from being powerless to being powerful.
This moment in time, because it's such an incredible moment in time, that we, as awful as it is, as many of our members of our communities that we've lost, that we have an opportunity to utilize it and to say, post-COVID, we changed our health patterns in this way. Post-COVID, these certain nonprofits were able to really secure themselves and be able to move forward and meet our needs in a different way. And so I just think that this is a particular moment in time, and I thank the Borough President for taking the leadership to make sure that it becomes a post that we can look back on and say that this is how we made things different for African Americans.
I saw a piece, because I'm a big believer in that you have to speak to people where they are and take them where they ought to be, and not speak to people where you are. Part of this movement must be that young people need to see how they're being played. The part of this movement is going to have to be, the winds of change have always been blown by young people. Always. And they have to start demanding that their food is of a qualitative nature in their schools. They have to demand that they're able to have good food in their communities. So this needs to be part of the movement.
This food that you have been told was your staple wasn't for you in the beginning in the first place. There are tribes and villages in Africa that wasn't eating meat. You know what I'm saying? Like, I don't know where everybody got this thing where it was a white man's thing. I think it's just been so whitewashed and promoted from that side that people think that that's what it is. But no matter what the outside entities are doing, until we take control of the reins, we're always going to let them guide us. And we're better than that.
And when I looked at my family, my youngest brother is dealing with prostate cancer. I just lost my dad a couple of years ago to that. My other brother's on chemo right now for thyroid cancer. My other sister lost a kidney to diabetes and kidney failure. Like I said, my other sister has breast cancer. So we should not have to benchmark our lives by hospital visits. And now they're all plant-based. They all are incorporating plant-based, and we're watching their recovery. Now, there are good days and bad days, and I told them, don't beat yourself up. But at the heart of the conversation is that they see now that food is their medicine. And, it's just a beautiful experience of watching that. I thought I was buried with diabetes, and I was planted to save my family. And, I don't feel powerless. I feel powerful when I sit down and we share recipes and we talk about, recovery. And, it's just a great feeling. It's a great feeling to do that. And I want our families all to experience that. That's why I'm so passionate about this area.
Is for anybody that watches this panel here, I don't want people to think that we're saying, oh man, vegan is just going to cure everything going on with you, but it's going to help tremendously.
Yes.
Like, we're not saying that, COVID-19, you go vegan, you ain't gonna get, like, no, we're not saying that. The thing is that people have to understand is that COVID-19 is attacking everybody. But then it's finding out once it gets inside you, oh, can I stay here or do I need to go?
There you go.
You know what I'm saying? Like, that's where it is. Ain't nobody safe from it. I don't care. I've seen on blogs and all this stuff, people like, oh, if you vegan, no, there's not. That's the same people that were saying if you black, you're not gonna get it 4 weeks ago too. That's not the case. It's coming after everybody, but you better your chances the healthier you are. We're saying you are bettering your chances of fighting not only this, but the next wave of something that's coming too, because this is not the end. It ain't the first wave of some kind of virus, and this ain't the last wave of some kind of virus that's coming.
You have to think of your health like you're investing in your future. And so when we put money away for our retirement, there's no guarantee that we're going to be able to live the way we want to live, but we're sacrificing right now in the present for our future selves. And so making the health sacrifices of choosing to run or choosing to lift weights or choosing to move or choosing to eat healthfully, you may desire other things, but you're perhaps making a sacrifice in the immediate sense to invest in your future self. It doesn't mean you're guaranteed you can never get COVID, that you can't get a heart attack, or that anything will never happen to you, but you're increasing the odds tremendously. And that's really the point. And so wouldn't it be beautiful if we had like a barbershop initiative that kind of went out and we got the barbers to kind of get on board to this, that we got the pastors of the large churches and the small churches to get on board to change their diet, to then be a reflection to their congregations at that point in time. Because we're all trying to do what Desmond Tutu said years ago, which is at some point, you got to quit pulling people out the river and figure out why they're falling in, right? And so that's really what it's about, is trying to figure out we know why they're falling in. We know why they're falling in. And that's what we're trying to do, is to kind of prevent them from falling in.
Thank you. I thank you all. And, I grew up on Frankie Crocker, and he used to end the show with, bye-bye, Hank. So, thank you. Appreciate you all.
Thank you, man.
All right.
Thank you. Good to see everybody.
Yes.
Have a wonderful night.